Good afternoon, everybody. This is Cody Hand with the North Carolina Healthcare Association. Thank you for joining us today. Before we get started, wanted to go over some logistics for today's session. All of your lines are currently muted and in listen-only mode. During the question and answer time, you may ask a question or make a comment by raising your hand by clicking the icon. It's the hand icon on the grab tab located to the left side of your control panel. Once you do that, your line will be unmuted. Please announce your name and organization prior to speaking. Feel free to ask questions at any time or make comments at any time using the question box located in your control panel throughout the session. Want this to be a conversation more than a presentation. This session is being recorded and will be made available on the NCHA website and through email notification shortly after the conclusion of this session. I'll be doing the main presenting today. We'll be followed up by Emily Rowland, who will talk about some logistics. And so if no questions or concerns, we'll get started. So today we're going to be talking about the current climate at the General Assembly. It's hot and the attitudes are bad. We'll be talking about the state legislative issues impacting healthcare and the things we may see coming down the General Assembly. We're going to talk about the resources, talking points, and messaging that we have prepared as a guide for you all. And we'll be talking about the NCHA Advocacy Day guideline throughout the session. As Emily will tell you in a minute, we're not having one day of advocacy. We're going to have as many as they're going to be in session. We'll follow that up with question and answers. But again, at any time you want to stop us and ask a question during the presentation, please feel free to either click the hand icon or type the question in the comment box. Current climate at the General Assembly, it is an election year. We still have a Republican supermajority in both the Senate and the House. So that means they can override any veto issued by the governor. That means they don't have to have Democrat votes to get a bill passed. So they are largely in control. They are suffering from the same thing everybody else in the unpredictability of Washington. Don't know what Washington is going to do on healthcare. Probably not a whole lot, but that always weighs in on what the General Assembly decides to do for 2019. And then every General Assembly seat is up for election, and every one of them has a challenge. There's not a single seat in the General Assembly right now that is uncontested in the general election. So all 170 of them are up for election. That's 50 Senate, 120 House. Quite a few of them are running in new districts. As you may recall, last year the courts forced the General Assembly to redraw quite a few legislative districts. So quite a few of the members lost their primary last week because they were in new districts. The others are going to be running anew. That means they need to have more face time in those districts, which means less face time in Raleigh. The prediction is because of the contentious nature of political campaigns these days, given all the influence from the national sphere, that they'll want to get out of Raleigh as fast as possible. This is a good opportunity to remind you, if you're a registered lobbyist, that you're not allowed to give to political candidates. And if you have a PAC, they're not allowed to accept money from PACs during session, which may be a good reason for them to get out of Raleigh as fast as possible. There continues to be a great deal of animosity between the General Assembly and the legislative and the executive branch. The governor is of a different party than the majority, and therefore they have spent the past year litigating a lot of issues that have been resolved over the past few months. But they continue to have a strained relationship. You might have seen recently the governor released his budget and the General Assembly immediately rejected it. But there is a great deal of excitement around the work we're doing on behavioral health. So while they're not getting along on much of anything, what they do agree on is they need to do some work to address behavioral health and the challenges created by the current structure. And so we're encouraged that even though they're not talking to one another very well, they are supporting us and talking about behavioral health. We'll talk about that specifically in a few minutes. As you may recall, our 2018 legislative issues on the state, and they can be found on our website. You see a slide there that go to our website, ncha.org. and hit on the advocacy tab and go down to priority issues and choose state. You can see our state issues. Each one of those has a resource kit related to it. These are the same as what were in the long session, and that is natural. And so we talk about certificate of need preservation, safety net payment preservation, also known as MRI gap, increasing access to health insurance coverage, nonprofit tax treatment preservation, behavioral health reform, telehealth expansion, and graduate medical education support. If you don't see it on there, it doesn't mean that we're not paying attention to it or working the issue. It just means that it was not identified by our board as the major priority issues to work and to watch. So we'll talk first about certificate of need preservation. And while I think this short session is going to be short and is not going to focus on CON, there is always invariably a bill every session and a budget provision every session to either repeal CON or to take away the most important aspects of the CON law that would really impact our ability to do our jobs. As you know, the hospitals and the health systems support the CON law as it is. We have not changed our position on that. We urge our legislators to protect the law and thereby protecting access to care. Now, there is an option for the department and for the rule makers to change the administrative side of CON. But as far as what the General Assembly concerns and the stuff that they deem necessary coverage under CON, we support the law as it is today. There are always efforts to undermine CON by carving out the money-making services. We will always oppose those. There is an effort I know of this session due to end-stage renal disease treatment facilities, what they did for endoscopy a few years ago. We're still discussing that with the bill sponsor and the people advocating for that. But as far as we're concerned right now, we've not changed our position on CON, and we continue to support the law as it is today. Don't anticipate seeing any major movement from one chamber to the other, with the exception that the Senate will likely put it in their budget provisions and will likely try to send that to the House. Now, we've been told they're not going to do anything controversial, but I'm not sure the Senate can't help themselves knowing that the House won't go for it. Before we move on, any comments or questions on CON? Any concerns? Safety net payment preservation. As our state's healthcare safety net, North Carolina hospitals and health systems have for decades worked up mechanisms to where we can draw down additional federal dollars to cover the deficits that we incur treating the Medicaid and Medicare populations. You may know it today as the MRI gap program, the Medicaid Reimbursement Initiative gap assessment program. As you all are aware, what that means is we health systems tax ourselves to draw down federal money. The state takes a share of that as a, for lack of a better term, ticket master fee, and then return the rest to hospitals that are distributed to each hospital through a formula. Under Medicaid reform, once you go to capitation, the federal government doesn't allow these sorts of payment programs. So our technical advisory committee and our CFO groups have worked very closely with the department over the past year and with the General Assembly even longer to reform that program so that we preserve those funds in a different way. We have, as of last Friday, presented most of you with the opportunity for a webinar. That's available on our website if you want to see more about what this means. But we have reached an agreement with the department about how to move forward with preserving the safety net. We're calling it preserving the safety net as opposed to preserving hospital gap funds. For two reasons. One, because what it does is it makes sure that each of our hospitals continues to have the ability to play the safety net for their communities, but it also takes the focus off of hospital finances and onto those communities that we serve. The General Assembly is invested in this because they have retention funds that they get from the MRI gap program of over $150 million, depending on the year. And so they're supportive of our efforts to make sure that we maintain these payments and these safety net funds from DC. Again, there's more information about that on our website about a recent webinar, and if you can't find that, just email me at chand@ncha.org, and I'll make sure that you have access to that website and to that webinar. Next up is increasing access. We, as always, support access. We support access to coverage for care for everyone. We do not. We continue to work with the care that the word is being spread around the state about the need to make sure that more folks have access to health insurance than fewer. There is a bill, Carolina Cares. It's House Bill 662. It was sponsored by the 4 Republican Health Committee chairs. It is a work requirement Medicaid bill. It would expand the population to that coverage gap for those who either have a job and don't make enough, or for those who meet some various exceptions to that. We've been told by the Speaker of the House that it is likely that this will not move in the short session. Senator Heiss on the Senate side said over his dead body would it move. So the chances of it going in the short session are slim, but the Speaker did say that there would be an effort in 2019 to revisit this bill and move it forward. Any work we do in the short session will likely be around ginning up support for 2019. And as always, everything we do could impact our ability to work on those issues for the next session. So what we do in the short session, while it may be short, while it may be non-controversial, will impact our successes in 2019. Nonprofit tax treatment preservation is next. North Carolina hospitals and health systems support the current sales and property tax laws. We have been going around the state over the last year talking about the economic impact of hospitals and health systems in North Carolina. And the reason that we've done that is twofold. One is to educate our communities about the role we play, but two, it's also to support our case that we by and large earn our sales tax refunds and our property tax exemptions every day through the care and economic impact we provide to our communities. I don't anticipate this legislative session will have any problem with this. They will be coming in to reform the Internal Revenue Code to reflect the changes made in Washington. If you don't know, many of the revenue laws in North Carolina cite federal law and are based on federal tax law. And with the massive federal tax changes that were passed in Washington in December, that necessitates the need for them to update many of the North Carolina codes. There will be quite a bit of decoupling from the federal code, but I'm assured that there won't be any successful attempt to address our sales tax refund or our property tax exemptions. Our conversations with our community partners, such as the League of Municipalities and the county commissioners, indicate that they're not going to be seeking any property tax changes as far as we're concerned this legislative session. But I think anything we do in the short session will be, again, with the focus of making sure that in 2019 they understand that we earn our tax treatment every day. Behavioral health reform, it remains a key priority for us for many reasons. One, because it's so necessary, and we continue to support access to the appropriate levels of care for all of our patients, regardless of whether that's in a hospital, a health system, emergency department, or off-site at a private location. We want them to be able to go to the right place. Last session, we got a bill through the Senate, Senate Bill 630, which would reform the involuntary commitment process. That bill was probably the first time in my career, a consensus bill that had very few objections. We've spent the past year refining it. We had the luxury of time, and it wasn't because the House didn't want to pass it. It was because it got there right in the middle of the budget, and the calendar got away from us, and we actually decided we'd spend the next year making some modifications to the bill to make it even better. So we've reached a point now where Senate Bill 630 is going to have a committee substitute run in the House. We've gotten stakeholder input and approval on a lot of the changes, but the good news is the intent of the bill remains what it was when we introduced it in 2017, and that's to reform the IBC process to make sure that our patients are getting where they need to go faster, and are getting the treatment they need faster, and are getting seen faster with fewer restraints and fewer restrictions. And only those who truly need to be involuntarily committed are placed under IBC. We're very hopeful and very positive that the bill sponsors on the House version will move this through the House as fast as possible. Procedurally, it has to go through the full House committee process, so it'll go through the Health Committee and then onto the floor where it'll receive some votes. Then, because there will be changes, it has to go back to the Senate, where the Senate will vote either to concur with the bill or will reject the changes and it'll go to conference. Our goal, and we'll be calling on all of you to help us make this reality, is that once it gets to the Senate, they concur with the House version and we move forward with its enactment. It'll be effective October 1st of 2019, and we are happy to provide you with a summary. You see at the bottom of the screen some infographics about behavioral health. These are some things that we're handing out at the General Assembly this year and that are available on our website for those of you who want to add it to any of your material that you're handing out at the General Assembly. Again, very hopeful that this bill will go through. We're very encouraged by the fact that many of the stakeholders, if not all of them, that supported the bill the first round continue to support it. Josh Dobson in the House is our champion, wants to move this as fast as possible. And we'll talk in a minute about the budget, but the budget's going to get passed first before we move forward. Before I go on, are there any questions? Telehealth expansion. North Carolina hospitals and health systems support broad application of telehealth services and urge lawmakers to remove any and all barriers to full implementation. There was a telehealth subcommittee that was commissioned over the interim, and that committee issued its findings in a report that would be considered in the short session. That would then establish 3 other studies that are due September 1st of 2019. Those subcommittees deal with parity, with licensing and credentialing, and with, I believe, broadband. The third one's escaping me right now. But we continue to work with our legislators to understand that the need for telehealth services is great, especially in rural North Carolina, and that it is also, if not greater in importance for us than many of our other issues as far as access. I don't know that we'll see much movement other than the establishment of studies in the short session, but I do know that many members of the General Assembly, if not all of them, are very keen on getting this done as fast as possible. This is one of those subjects that we work both state and federal on. There are many federal barriers that we're working to remove, especially under the Medicare program, but the state barriers are great, and one of the biggest ones is access to the internet and broadband access. And so we're teaming up with our education folks, our partners in the education sphere, so that when one of us talks about broadband, it's not just for our own benefit, but it's both for education and for healthcare. Again, not sure how much of this is going to move forward in the short session, but we are hopeful we'll get something done again to build the momentum for 2019. Graduate medical education support. We continue to focus on how do we build GME programs in rural North Carolina. We continue to support existing GME programs and adding to those. There are many at the General Assembly who would like to take the current program and alter it to focus on rural healthcare. We have worked with them, and I believe we're almost to the point where everybody now agrees that we need to keep the existing program and add to it as opposed to replacing it. So we continue to support those measures. The General Assembly continues to study it, and I don't believe they've quite figured out what to do. They're reticent to do anything that spends more money, which means it's going to be very hard to expand the GME program, but we're working with them. I'm not sure that we'll see any legislation in the short session on GME. I would doubt it highly, as long as we, as you know, keep the current GME program. And at this point, I believe we have a question from Amy.
Although the League of Municipalities. Thank you. Says challenge to NC tax is unlikely. Is there a possibility that each county could explore this issue, especially in counties that now have Republican stronghold?
So the question was, even though the League isn't pushing for property tax changes right now, will the individual counties do that? There are a few individual counties who have examined property taxes and have gone to the General Assembly about it, but absent the League's coordinated effort, I doubt you'll see much movement from the General Assembly side. Counties can't, they could theoretically get local legislation passed, although with revenue laws, it's a statewide law prohibiting the counties from levying these property taxes. And so I'm very doubtful that you'll see anything coming that would allow specific counties to enact property taxes on nonprofit properties. Any other questions before we move on?
Thanks.
So the short session, we're told, and I'll I'll close before we have any questions and turn it over to Emily. We're told the short session is going to be short. It is an election year. The speaker says nothing controversial is going to move. He has shut us down on some other requests we've had on insurance regulations, and so I tend to believe him. I tend to believe Senator Berger that they want to get out of town as fast as possible. It is a tough election year, and we need to make it as easy as possible for them to leave. As part of the reason we want the behavioral health bill to move forward with stakeholder consensus is because if it becomes a confrontational bill, it likely won't move through this short session. And we've put too much work into that bill, and we've used a lot of your time on that bill to let it languish because of a few things. And so I'm fairly confident that that is ready to be pushed forward without any controversy. That said, you never know what's going to come up at the General Assembly. You never know what poll they're going to see that's going to make them act. I'm told there may be some constitutional amendments that they'll be voting on. It's very unlikely that we'll weigh in on constitutional amendments, at least at the General Assembly side, unless it's something that directly affects healthcare. So with that, I'll close and take any questions before I turn it to Emily. Hearing none.
Hey everybody, this is Emily Rowland, Member Advocacy Director, and I just wanted to talk with you a little bit about what we're planning to do regarding Advocacy Day and action plans throughout this legislative short session. I know folks have asked a lot about when is Advocacy Day, mark in your calendar for Advocacy Day, which we certainly appreciate, as we typically host one day that we focus on each legislative session to bring folks to downtown Raleigh. But things have changed a little bit this year in what is allowed at the General Assembly because of new security measures that they are putting in place. They're putting up metal detectors and some other things in the building, and with a number of those changes, they are not allowing in the same way tabling opportunities at all down at the General Assembly, nor are they allowing really large groups to come without pre-registering and some other different things they've put in place. So we don't know if that will change in the coming year, but for now, this is what's in place. So we are really encouraging advocacy every day. But let me take a step back and just say that we're going to be sharing the slide deck that we're putting up here today, as well as a recording of this presentation online. So that will be available. But to support the issues that Cody talked about, we have a number of materials online that you can find. Again, if you go on the advocacy section and priority issues and state priorities, anyone publicly can see our position statements on each of those priority issues. That is available to anyone. You do have to have an NCHA member login in order to access these materials that I'm mentioning and showing on the slide deck now. And these are more in-depth materials that kind of go beyond the position statement to help understand some background and context and bills that are related to the issue, and then talking points and some information, some arguments you might hear from legislators or other stakeholders, and how to talk about those as well. So our advocacy communications folks have created these great tools to help you all talk about and understand each of these position statements. So again, if you don't have a login, there's an option to have something sent to you. If you have any trouble with that, please reach out to me directly and I can make sure that you get a login to access these materials. So again, by issue, there's an example of one for certificate of need shared here, but there is the position statement, the background. Again, you see associated legislation, and then all of the messages. And all of those are sourced as well, so you can take a deeper dive into some of the articles related to each of those issues as well. So we hope this provides you some really helpful tools to talk about these issues with your legislators, either during your visits downtown or, of course, in ongoing conversations you have with your legislators as part of those relationships. A few other tools and resources I wanted to mention. One is we have buttons. I know folks are excited about that. This was a request from members to have something to identify groups from our hospitals and health systems downtown, as well as encourage some great dialogue with lawmakers and others for folks that are downtown as well, associated with our hospitals. As you know, typically on Advocacy Day, we encourage you to wear the big blue H stickers that we have. or possibly your hospital lapel pins. So this is something, again, in addition to that, we'll have opportunities. Cody or myself, somebody will be downtown that you can touch base with, if not just the government relations officer at your hospital. We'll make sure that they have these materials as well when you're downtown. You can have one of these buttons that says, ask me why healthcare matters. And hashtag healthcare matters is the ongoing tagline we're using throughout the legislative session to share this information on social media. So we encourage you to use it. And if your public relations folks at your hospital are going to be sharing and talking about your visit, we encourage them to use it as well, just to share positive messages about your visit downtown, or just things you're doing as well at your hospital. But we're, again, encouraging that for some useful, helpful dialogue around some of these issues. So we'll have those buttons available. We also have a community benefit report that we're finalizing now. We encourage all of our hospitals to talk about and share their community benefit reports for their specific hospital, but we are creating a statewide community benefit report that can be shared downtown to talk about the ways hospitals give back to their communities and put some dollar amounts around that as well. And this is in addition to the big four, the charity care numbers, the bad debt, and the Medicare and Medicaid losses that we talk about. This is in addition to that, really looking at the other ways that hospitals give back to their communities. We have an economic impact report and infographic that's been available, that is available on our website as a nice handout. We have some leave behinds per issue that have been created. Again, you can find on our website. I just want to mention these so you know that they're there. There's one for behavioral health, and there's some others that are in process that are, in addition to the talking points for you to talk with legislators, these are nice leave behinds to give to a legislator that provides some numbers around these issues. We'll also be sharing, I'll be sending out, and we'll continue to send out weekly emails to our government relations staff, letting you all know the week ahead, what the theme for the week ahead is, and the social media hashtags and prompts that we'll be using. And I'm providing some examples on the screen here. There are just really great ways, if you're down at the building, to just briefly take a picture of the folks you're bringing and share some positive messaging around their efforts to talk about healthcare down at the General Assembly. But these are things you can do in your hometown as well, even in district. Great opportunities always to thank your legislators, so be sure to tag them and thank them for the work they're doing, or just having the conversation. I'll be talking briefly in a few minutes about some specific efforts we're doing around behavioral health. But during Behavioral Health Advocacy Week, we are investing in some additional social media boosting, ad boosting, and geofencing around the General Assembly to really target our legislators and share our behavioral health messages, and thank those legislators that have been really instrumental in helping some of that legislation move forward. So we hope all of this will just help amplify the message that you all are delivering during your visits, as well as in the district. Again, even though we don't have one targeted day where there seems to be, where there's really strength in numbers, when we have, close to 500 hospital and health system advocates downtown, it doesn't mean that there can't be a really strong presence felt through these different avenues. So I wanted to mention a few other tools. We have Preparing Your Advocacy Story and some other webinars that were created by the advisory board for us this year, specifically for NCHA. We have a focus on this year bringing more care team members. These are clinicians and other folks you have at your hospitals that work directly with patients, engaging them in advocacy. So these tools are focused on speaking to those new advocates, but they can really be shared and used by anyone. There are 3 of them. They are webinars, so you have a slide deck and speaking. That each of them is just under 25 minutes long and can be listened to at your leisure. And none of these are password protected. They're openly available under our Advocacy Day preparation tools on our website. One is U.S. Healthcare 101. It's really just a background about what the climate is, what's brought us to where we are. There's a focus federally, and then and it touches on some of the state issues as well, but just kind of what's happening in healthcare today. And then it goes a little bit deeper into advocacy and the healthcare ecosystem. So why we need care team members as well as others, to be involved in advocacy efforts, and what it means to not just be on the sidelines for some of these issues that are happening, but how we can really be part of participating in policy change, and then preparing your advocacy story. And we always talk, I know, to advocates about how to get involved and talk about these issues in a more personal way. And so this is more of a workshop where you can pause during pieces of it and help craft how you want to talk about an issue, how you might want to consider other stakeholders that are involved, and so that you can really have a really intentional and nice conversation with your legislators, considering kind of different pieces of the issue and how you want to talk about it. So we hope you find those helpful. Those are there for you. We also have a webinar that was prepared last year that's just a very basic what to know before you go. If you are meeting with your legislator there in Raleigh, how to prepare for that meeting. I will say this is a webinar from last year. It's a recording, so please disregard the dates from last year that are shared, but the information shared is still very relevant. So if you would like to access that as well, that's also on our website there. A few more tools, because again, we want to make sure you all are prepared and have what you need to get involved and to get folks at your hospital that might be new to these efforts involved. We had a great interview with Representative Gail Adcock, and she, as many of you all know, is a nurse practitioner and works over at SAS and leads their medical team there, and really talked with her about how and why she got involved in politics, and some of her really tips about how care team members, again, still a relevant message for other folks as well, but she's really focused on those care team folks, so nurses and docs and others as well, about why and how they can get involved in building relationships with their legislators. Each of these are podcast interviews. They're under 15 minutes, some as little as 3 minutes, so really great snippets that will be easy to share with members from your team. And again, she touches on what does effective advocacy look like, all the way down to what should that first email look like that you might be sending to a legislator. So some really great tips here that I hope you'll take advantage of. These are in a member resources portion of the website, so again, they're password behind the NCHA login, but again, reach out to me directly if you need another way to access that, and I can share those in a different way. But we hope those will be helpful, and those will live on our website all year, not just in regards to Advocacy Day, but all year as ways that you can engage care team members in advocacy efforts. So quick tips for a successful visit to the General Assembly. Again, know the issues, check out things online. If you are driving with folks, review things in the car on your way and know how you want to talk about it. Be honest and be brief. These meetings won't necessarily last. You shouldn't expect them to last for an hour. Our legislators, I know, are busy with meetings and going into committee meetings and in various parts of the session, and so won't always have time to maybe meet for a long time. That doesn't mean that your meeting is any less important. So just be available and know that if schedules change, even if you have hopefully scheduled these meetings in advance, if schedules change, it doesn't mean you can't meet with them in the hallway. If you see them and can grab them that way, or just want to walk with them on their way to a meeting, that's expected and welcomed from a legislator, or even just talking with their staff if they are unavailable. That's always important as well. Definitely be sure to try to bring your message back to how it's impacting patients in your community, not just the health system, but the patients themselves. And be sure to thank them for their service and how they're serving our state as well. And follow-up is key. So taking a few minutes just to provide a handwritten note or just an email afterwards thanking them for the time will help keep the door open for a conversation for them and other issues and healthcare issues going forward. New this year, and again, these are things we're all learning and adjusting to with these new security measures, is there's going to be enhanced security when you come into the building that has not happened in previous years. It says expect long lines. There are going to be busier days than others. So, for instance, with the teacher rally tomorrow, there's going to be thousands of folks downtown. We will try to make you all aware when we know that large meetings like that are happening. But long lines really are in regards to those really, really busy days where there's going to be large groups, and we'll make you aware of that. But there will be longer lines than typical because you typically can just walk right in those front doors. So they are going to be looking through bags and checking just to make sure there various things are not included in your bag. So just be prepared for some of that and try to bring as little as possible. The cafeteria may be crowded. Apparently less folks are interested in leaving and going off-site for lunch because of these different security measures coming in and out. So the cafeteria, which is located in the basement of the legislative building, may be a bit busier. Just be prepared for that. Again, just to reiterate, they are not allowing the tabling opportunities in the courtyards that we've participated in before. We hope that changes in the future, because I think that was a nice way that we hear from members about participating, and we hear from legislators that they enjoyed seeing that information shared. But for this year, that is not allowed. And then bulk materials must be pre-approved. So if we are planning on handing out anything to all 170 legislators, we do have to have that pre-approved. So I'll be working through to have that done for any of our larger materials. If you're just handing things directly from your hospital to your legislator, or even to a full committee, even up to 30 folks, none of that needs to be pre-approved. They're really just looking for any kind of really lengthy documents or things that are going to be kind of flyered around the General Assembly to be pre-approved. This is an overview of each theme during the legislative session and what we're focusing on around our messages. Any of our legislative priorities that were mentioned earlier can be discussed during any of these weeks. These are very broad themes, but wanted to give everyone a cohesive feel. If they're, we're going to have a number of health systems down at the General Assembly each day. So if there's kind of a cohesive way for them to share messages, that's why we built these different themes. And they all kicked off last week with Hospital Week in your district. And so these are all shared on our website as well. Under each of these, we have hospitals that have already signed up to say we want to bring folks to talk about these messages and to talk about our issues. So we're excited to have a really nice, robust schedule of hospitals visiting the General Assembly this year. Our goal is to have someone from one of our health systems available every day during the session, at least one person there. Again, aside from our lobby and GR teams as well, but someone there representing hospitals and health systems. And it's looking like we're going to be able to achieve that. But there are definitely still gaps. So please, if you have not signed up for a specific day to bring your health system downtown, please let me know, and I'm happy to get you the materials you need and then plug you in where we might have some of these gaps. I wanted to draw special attention to our Health of the Mind Behavioral Health Advocacy Week, which I'll talk about here briefly. Oh, one other thing to mention is the calendar that we've shared online. In addition to just telling you the weeks, it also shares the messages we're going to be focusing on, social media for each of those weeks, as well as making folks aware of days that you might want to keep in mind that week, where a certain group might be there, if there's when the county commissioner, health organizations are going to be who in your community or who others alongside you, and build on those visits if there's a. So again, a little bit more really target a week, with that being really one of our top issues that we're addressing, and something we might move, as Cody mentioned, this session. So during the week of June 4th through the 8th, we are going to be really focused on our behavioral health messages. And specifically on that Tuesday, Wednesday, and Thursday, we are going to have extra support provided each of those days to kick off into a regular advocacy day, where we provide a morning orientation from 8:30 to 10 a.m. Each of those mornings. We will be encouraging folks to join us at Kairos Government Affairs groups, or contract lobbyists that we work with downtown. They have an office in downtown Raleigh where we'll be meeting each of those mornings between 8:30 and 10. Cody will be on hand to give an issue briefing, talk about anything that might be moving downtown that we want you all to be aware of, handing out materials to have available for you. And so we encourage folks to park and join us there for that morning meeting. And then you can just walk downtown to the building. It's just a few blocks away. So we want to make that easy and coordinated for you to meet with lunch vouchers that day, as well in the morning orientation. Grab those that anyone can use in the cafeteria if you want to schedule a lunch again with your group and use that there. Policy under grassroots, there's a whole section on Advocacy Day, but please don't hesitate to reach out to me directly. Well, there's Cody's contact information. My contact information is also online, eroland@ncha.org. If there is anything that you need to help prepare your advocates in a more personal way than what we've got even shared here, I want to make sure that you all feel prepared. So please let us know how we can make your day a success. And we thank you so much for your time today as well. And I want to open up for any questions for both Cody and myself about participating in advocacy or what we're anticipating coming down the line this session. Okay.
If there are no questions, thank you all for joining us. This concludes today's session. Thank you, and please take a moment to answer a short survey. No survey? We're not going to survey you. Please feel free to give me a call or Emily a call at any time. If you've got my cell phone number, it's 919-793-8318. Again, thank you for this legislative session. I think it's going to be a great session for us, and it'll only build up until 2019. So thank you all, and have a great day.